Assume that you're an asymptomatic carrier. Okay, what that means is, well, you probably won't get any manifestations of the coronavirus, but you can sure enough pass it to everybody else. Okay, so if people might be getting, just like at the White House, when we look at the news going on with it, there's so many people up there that's getting COVID positive results. There's a couple of people that aren't wearing masks. Y'all know who they are. I ain't got to give them no oxygen. Well, somebody's got to be a carrier around there. They may not show any manifestations, but there sure are a lot of cases up there. All right. My whole point is get tested so that you can know, so you can put that out your mind. All right. Well, as far as what the test, there's different types of tests. Right now, most of the tests are geared around getting a swab up your nostril, in your nasopharynx area. It's a little far back. And no, people aren't used to, people are usually used to sticking their fingers up their nose, but not a swab. Okay. I don't know what's the difference, because your finger is way bigger than a swab. And some people can get on up there with their finger, trying to clean them crannies and nooks out. But, it doesn't take long. It's less than a minute. Okay. It takes about 3 to 5 days. Well, right now, there's probably a lot of people getting testing. So, it may be on the 5-day side. But if you got it, you'll be contacted. They'll tell you what to do, which is stay at home. Don't be around anybody. All right. If you don't have it, then good. All right. You probably, like I said, either you have it. More than likely, I'm going to go back and I'm not going to recant what I said. We've all probably been exposed in 78 days. Okay. So maybe your immune system's superior. Start assuming that. Okay. But that's where the carrier part comes in, because if you got elderly parents or grandparents, well, they may, with their medical challenges, may not have the same immune system, and they could be exposed, and that's why we limit our exposure with them, which is causing a devastating effect on our family unit. All right, but let's go back and address the idea about the COVID seeking out people of color. Well, like I said, COVID is equal opportunity. Okay. Part of this, remember when I first talked about infectious diseases in the political process, you got to remember there's a political season going on. There's a lot of media out here. There's billions of dollars that are out there to control everybody's mind, thought, and emotion. Okay. So if you're feeling nervous, it may not be a reason, but the money. And if you are one of them political junkies that don't do nothing but watch political commentaries all day, well, you're probably in that mood, or in that's where you are, because they're feeding you all this. You're letting all this get in here, when wisdom would tell you no, don't. Power would say no, you can't come in. All right, but it won't be long. There's going to be somebody else's turn. This is the political season. They get people, the media drums up things, but I'm not saying that there wasn't a lot of people of color, but when you really look at it, and especially in Georgia, now New York may be different. New Jersey may be different. But, and I know people who've been affected by it, but in terms of when they say it's disproportionately affected and there's like 80,000 deaths, well, if 80,000 deaths and they say disproportionately, I like to hear the term, especially if they're going to say black people, have almost 35,000 black people died because of this disease. Y'all feel me? You see where I'm going with this? And if it was, we would have been to known that. So that's why I say take everything with a grain of salt. Calm down. All right. But let's just talk about that White House for a minute. It's getting around up there. There ain't that many people of color up there, is it? Think about that. All right.